Good evening, dear friends. This is me, Ishita, and I welcome you to the session 5 of Spot Virtual Classroom. I hope you all are having a good day and excited to listen to the next topic, Advanced Medicine. Advanced medicine combines the best possible therapies, methods, and procedures of traditional healing arts with appropriate conventional medical knowledge and the very latest developments in high-tech medicine. Advanced medicine relies mainly on therapy with natural biological remedies and tested proven methods, which administers in conjunction with the latest technologies. Accordingly, advanced medicine represents the gentlest concept imaginable in modern medicine. In the realm of prevention, it can be a real feel-good medicine. Let's pick up more into the topic, advanced medicine. Respected principals, teachers, and students, it's my privilege to welcome and introduce you to Dr. Subramania Iyer, one of the patrons of BSSF and a medical doctor of immense repute. He holds the distinction of being the first doctor in Asia to have done a double hand transplant. Dr. Iyer currently serves as a professor and chairman of head and neck surgery, oncology, and craniomaxillofacial surgery at Amrita Institute of Medical Science and Research Center. Apart from his clinical responsibilities, Dr. Iyer is an avid teacher and researcher. He teaches and trains postgraduate scholars pursuing MCH in plastic surgery, MCH in head and neck surgery, and oncology. Dr. Iyer also has authored over 50 scholarly papers and 3 book chapters relating to plastic surgery and head and neck surgery. He has represented and published his work in national and international journals and forums and has won numerous awards and accolades. We are delighted to have you with us, sir. Now, may I please welcome Dr. Iyer to address the spot talents on today's session, Advanced Medicine.
Thank you very much for the kind introduction and the chance to speak to you once again. When we are talking about advanced medicine, I was thinking of in depth about what all the things which you can address. Now, medicine itself, medicine is a very, very large topic, and with probably around 50 subspecialties. And then if you look at it, advances occur in each and every specialty in medicine. So to look at advanced medicine and to concise it in maybe one talk is absolutely impossible. I would say maybe I would need around 30 to 40 talks to you to address even some of the aspects of advanced medicine in each specialty. So I thought today to select some topic which is of social relevance, as well as it will be of practical importance for you, for your general knowledge, as well as for helping other people. Because this topic which I'm going to talk is itself is vast and multidisciplinary and multi-organ, sort of involving multi-organ diseases. So the topic I was going to talk to you is about organ transplantation in general first, and then something related to organ donation also, because it is something intricately associated with organ transplant. Now, why I chose organ transplant as a topic is, this is one of the greatest innovations that have occurred in modern medicine in the last 3, 4, 5 decades. In fact, the only time when a Nobel Prize was awarded to a surgeon has been because of the organ transplant, which occurred. The first organ transplant which happened was for kidneys, and that is the time when a Nobel Prize was given to that person and team which carried out the transplant, which was absolutely revolutionary. Since then, a lot of things have happened in organ transplant. So I'll take you through some of the aspects. Let me share my screen, and then can you make me the... Oops. I need to share my screen. Yes, is here, and then so I'm just going to take you through these slides because it's easier for you to understand these things when you see the slides and the content. So let us say this is the thing we are talking about: organ transplants and donation. Now, I'm going to address this issue in these four headings. What are transplants, when it is done, which are the organs that are transplants, and how are they done? Because it's very important for you. When you hear about organ transplants, many of them wouldn't know how it is being done. So I will address that also in this. Now, what are organ transplants are very, very important to know. It is something like, we have all lot of organs in our bodies, and we are trying to sort of place that individual separate organ into an area where it is missing. This is to replace the function of that failing organ, or improve the form and function of the recipient because if it is deficient. Example is replacing a failing kidney. The kidneys, that the kidneys are the organs which filter our waste materials. If they fail, it can be dangerous to life. So replacing a failing kidney is a transplant. Then that blood is an organ. In fact, blood does a lot of functions. And when blood is lost by some injury or any of those matters, life can be a danger. So transfusions of blood is actually transplanting of blood from one person to other. The third scenario is slightly different. You lose a lot of areas of the body, like a jaw, because if it is removed for cancer, you tend to lose the jaw. So replacing that is also a transplant. So let us see what are the varieties of transplants. These are the 4 varieties: autotransplant, isotransplant, xenotransplant, and allotransplant. I will take you through each separately. Autotransplant is something when an organ or tissue is taken from your own body and transferred to some other area. This is a typical example of, as I told you, when you lose your jaw for cancers, we try to replace the jaw with a similar shaped tissue, that is the bone, which is shaped into the jawbone shape. So here what you take is to take the leg bone, shape it in the shape of the jaw which is lost, and place it back where it is lost here. And how do you do it? By taking this bone out and placing it there, and the only area of concern here is to re-establish the blood supply. That is done by microsurgery. So this is something called autotransplant. Isotransplants are the ones if you have an identical twin, then you are genetically identical to that person. So if you transplant any organ from that particular person, like a kidney or liver or anything, there is no immunological problems because you are identical. But it is rarely possible because we have very few genetically identical twins, and their requirements of a transplant between them is also very minimal. Xenotransplants, for the matter, is one of the most difficult things because it's transferring an organ from another animal. You would have read recently about pig heart being transplanted to a human being, which is, again, I'll come to that in a minute after that. But generally speaking, animal transplants are impossible because they are totally of a different immunological spectrum from the human beings. So they get rejected immediately. Now, there are certain situations where it can be used. Like we all use porcine valves, heart valves, bovine, like cattle heart valves, which are treated. And so, but they don't have cells, so they don't get rejected. And recently, if you look at, there was a news item about a pig transplant, pig heart transplant. But that pig heart was genetically treated and all the genetic elements of the pigs being removed and replaced by human elements. That is totally in a research stage and not in a practically applicable way. Lastly, the most important thing is allotransplant. That is transferring an organ from human being, but of a different person, like any other person, you and me, it is an allotransplant. That is the transplant which practically is occurring day in and day out. Whenever you talk about transplant, we are talking about allotransplant. Blood, kidney, cornea, everything can be transplanted. This is a tissue transplant. Here, the tissue transplant which is being done, like kidney, blood transplant, blood transfusion, or kidney transplant, anything that is being happening, the main problem is a antigen-mediated rejection. Like we know that we are all of different blood groups. That if it is not compatible, it can be rejected. Same way, we all have antigens in us. In the blood the white blood corpuscles, they have antigens, which is called HLA antigen. So these are different from person to person. Based on that, the body can reject your transplant. That is the greatest problem. So this is usually it is allotransplants from another human being. And let us see when it is done. When your vital organs are failing, life is in danger. Like kidneys, I'm just taking the example of kidneys because this is the most common transplant, and that is the most well-known transplant also. Kidneys take care of removing the waste materials from our body. It is done by filtering the blood, and then it passes out as urine, which you all know that we have to do that every day, several times, so that the waste materials go out of the body. When they fail, one option is to substitute the function of this kidney by a machine. This is called the dialysis machine, which you all know, which you have heard. It is actually an artificial kidney, where the blood is passed through the machine and the waste material is collected and it is pushed down. And this is needed lifelong because your kidney works every day. So you have to continue this dialysis once in 3-4 days, every day if your kidney fails. The other option is to transplant the kidney from another person. Once it is done, it is taken, it functions as a normal kidney. What are the organs that can be transplanted? There are a lot of internal organs that can be transplanted, which include the heart, which includes the lung, kidney, liver, pancreas, small intestine. All this can be transplanted. And then there is something called composite tissue transplant, which includes these things like hand, face, uterus has been transplanted now, cornea, that is the eye transplant is very, very commonly known. The cells which are transplanted include the bone marrow and the blood, or there are a lot of blood parts that can be transfused. Other tissues that are transplanted are the heart valves. You can transplant the bone, you can transplant the skin. Skin is transplanted when there is a loss of skin when you have burns. Now, let us come to the advantages and disadvantages of different transplants. What are the advantages of organ transplants? It replaces the diseased organ and restores the function. It is life-saving and improves the quality of life. But what are the disadvantages? Why don't you do transplant in each and every case? Unfortunately, transplants needs lifelong immunosuppression. This is because your body tends to think that the organ you get is somebody else's. So it tries to reject. It takes it as a sort of affront to the body. So it tries to reject it. Then, is there a problem? How do you circumvent that? You need to take medicines to prevent this rejection. But then, why can't you do that? The problem is that immunosuppressants are not good for your health if you take it for long term. And another problem with transplant is that it needs a donor. You need to take the organ from a donor. And it is technically challenging. Only very few centers can do it. And also it is slightly expensive and difficult to maintain the organ. Now, coming to the crux matter, how are the transplants done? Now, you need a donor, either live or dead. Now, what are the organs which can be shared from a live donor, live person? I can donate one of my kidneys. I have 2 kidneys. So I can donate one of my kidneys with impunity, without any problem, to myself. And I can donate part of my liver without causing harm to me, because my liver will regenerate. So these are the 2 organs that can be transplanted from a live person. All other organs has to be procured from dead people. Tissue matching is very important. Can every organ be taken and put on to the other person? No. We need to do tissue matching. Blood group matching is important. Like, so you know that blood matching, O group is a universal donor, whereas AB group is an universal recipient. So that matters in this also. More than that, you have to have a HLA cross match. This is something, there are a lot of methods of cross match, but I'm just simplifying you by putting this way. You take the serum of you take the blood of the donor, centrifuge it, get the serum, And this serum is cross-matched to the recipient to know whether there is reaction or not. If there is a major reaction, it means that this organ won't be suitable. So you have to do that. Coming to the timeline of the successful transplants, as I told you, the first was a cornea transplant. It was in 1905. 1954 was the first successful kidney transplant by Joseph Murray, who was awarded the Nobel Prize. 66, first pancreas transplant happened in US. 67 was the first liver transplant, again US. 67, first heart transplant in South Africa by Dr. Christian Bernard. 87 was the first whole lung transplant that happened in USA. And 98, the first successful hand transplant was done in France. And 2005 was the first successful face transplant that happened in France. And the first successful penile transplant was in China in 2006. Now, how is a kidney transplant done? Is like this. See, this gives you this picture gives you idea about how, see, you can see this, the shrunken kidney here in the top. There are two kidneys, both of them are shrunken, and then that's why it is not working. So when you take the transplant from somebody else, you don't put it in the place of the kidney, in the place where the kidneys are usually situated. You can put it in the abdominal cavity, connect the blood vessels, and connect the ureter, that is the duct which takes away the urine from the kidney to the bladder. So this is the way you do a kidney transplant. And when it is hard, it has to be placed in the same place. Otherwise, it won't work. So this is the diseased heart, which is removed and then replaced by a new heart, which is sutured to the blood vessels here. So this is how heart transplant is done. And this is the liver, which has been taken out. And then this is the cadaver liver, which is taken out and placed it in the area where the liver is usually seen. So this is connected with the blood vessels. This is connected to the ducts that take away the fluids. So it is a laborious process. So this is the partial liver transplant which can be done. The corneal transplant, you should know what is basically corneal transplant, because it is one of the commonest ones that is being done. See, the function of the cornea, that the cornea is the transparent thing in front of your eye, is to focus light into the retina. When it is opaque, it cannot transmit the light. So transparency and shade of the cornea is very important. When it is gone, like, when it is gone because of the injuries or birth defects or infections, it can cause blindness. So when, see, this is the cornea which has become, should be transparent, which has become white. Here, you take off the cornea and then put the new cornea back from the dead person, which becomes and sutured back and gives you excellent, normal functioning cornea. So this is a transplanted cornea which allows them to see. Lung transplant is when you take the lung away from the person and then put it back in the right place. And now this is an unusual transplant, which is called the face transplant. So you see the lady who on the right side, she had 17 surgeries for her face reconstruction after her gunshot injuries. No method gives adequately good sort of reconstruction. Whereas on the left side here, you can see the lady, same lady after a face transplant, giving her excellent sort of appearance and function. And this person was one of our own patients. You can see this is a patient who had lost both the hands. And you can see how difficult is it for them to do day-to-day work. He is trying to take away comb his hair. So you can see how difficult it is. He is doing that. Now let us see how he uh, drinks a cup of water. It's like this he does. So you can use prosthetic hands for that, but they are very heavy. This is a machine hand, a robotic hand, which you can use it, but it's very heavy and expensive and can break down. So what is the solution? Is to take the hand from a dead person, and then when you take the hand, you give back the body a prosthetic hand like this, and then connect all the, see, prepare the hand and connect this the whole hand to the recipient, the person who has lost it. You have to connect 25 tendons, 6 nerves, 2 arteries, 5 veins, and 2 bones. It is a very laborious process, but with that, what you can do is to achieve is this one. You can see that this person who had to struggle like this can do this within 3 days after the surgery. So that is the miracle of hand transplant. So these are our first 2 hand transplant patients who can enjoy back their life after their hand transplant. So it can bring, this is another patient. This is another girl who had a upper arm transplant who is working on that. So again, she has pursued her degree, and then she's employed after getting back her hands. Now coming to the second part of the talk, what is the most important component of organ transplant? Is the organ donor, because unless you have a donor, nobody can have a transplant. And as I told you, you can have 2 types of donors, live donor and deceased donor. Live donor is anybody, any one of us can be a live donor, but it can be related or unrelated. These are the related. I don't want to go into it, but I just want to tell what is the, who all can, what can you donate when you're live is only 2 organs. As I told you before, it's only the liver and the kidney. So what are the, who can donate organs after death? This is something we have to understand. There are 2 types of death. One death is the brain death. The other one is a cardiac death. Cardiac death is when your heart stops working. You have a massive heart attack. Your heart stops. Then no blood supply goes into any part of the body. What can you donate after that? You can donate your eyes, you can donate your skin and fascia, you can donate the heart valves, you can donate your bones and tendons and cartilage. All this can be donated even if you have sustained, anybody has sustained a cardiac death. So any dead person, you can donate the eyes, the corneas, as well as one of the most useful thing which we all ask now is for the skin. Because if you have, there are something called skin banks where you collect the skin from dead people. Why is it collected? This is mainly collected to be given to the people who need it after sustaining major burns and injuries. So this is an important skin donation, which is called the skin donation. Brain death is something different, which you need to have know the concept. because there is a lot of misunderstanding and misconceptions about brain death. See, what happens? What are the causes of brain death? Injuries, mainly the road traffic injuries, tumors, intracerebral hemorrhage, ischemia, all can make your uh, brain go dead. But what happens to the other organs when your brain is dead is that the heart keeps on working for at least 24 to 72 hours. This makes all the organs viable and it receives the blood supply, so they are viable for at least 24 to 72 hours after your brain death. So you can donate the organs. Somebody who is brain dead, we can procure the organs out of them during this window period when their heart is working. How is brain death confirmed? This is another big problem, because people say that you're declared brain dead so that you can take out the organs. It cannot be done like that, because there is a lot of laws and there are a lot of norms to decide whether you are brain dead or not. You cannot breathe without a ventilator. There's no response to pain. There is no response to light. There is no pain response to there are certain things called brain stem reflexes. So there you cannot, you are supposed to be brain dead, and then there you do a series of tests. And 4-member panel of the team have to declare the brain death. It has been done twice. It has to be one person from outside the institution, and one person has to be a neurosurgeon or neurologist. So nothing can go wrong with the brain death certification. So is there any chance that the person can come back up to life after brain death? No, impossible, because that is not possible at all. And then the next question is that will the body get mutilated because of organ donation? No, because they are all internal organs, except when you are donating your hands. So all of them are internal organs, and it doesn't mutilate your body. It leaves a small scar in your tummy area or chest area when you are taking out the heart or lungs or abdominal organs. You can donate this number of organs. You look at the number of organs, starting from eye, you can start blood vessels, kidneys, small intestines, pancreas, skin, bone, liver, heart, lungs. So ultimately, you can have these number of things taken out of a brain dead person. So what does it say? One person who is brain dead can save 6 to 8 lives, provided there is a consent for organ donation. Why is it important? Why did I choose this part of the talk to talk to you all? Because you are the people who are going to change the world. And why is organ donation important is there are millions of people who die each day. Each day there are millions dying because of organ failure, especially kidney, liver, heart, and lung. People die because there is no organ available. You cannot have heart taken from a live person. You cannot have lungs taken from a live person. And kidneys being donated by unrelated people, that is a big problem, social evil. So in order to mitigate that, there need to be much more increased awareness and organ donation. That is the reason why I was emphasizing on this thing to you all in particular. If you look at it, Spain has the largest sort of organ donation in the whole world. And there is no waiting list there because everybody who is eligible for organ donation, every individual who is brain dead is consented for that and they take the organs. In India is abysmally low, very low. So we all depend upon for kidneys to a live donation. For liver, you look at live donation. Heart transplant doesn't occur because there's no donation at all. And what is the main problem? Is a consent from the relatives. Because if you are brain dead, you cannot give consent. Your relatives have to give consent. And this is where we lack. We lack the sort of commitment to it. And this is where you all can make a difference. When people know about it, when there is somebody who is eligible to be a donor, and if you have somebody, unfortunately, it should not happen, but it happens. In that case, a consent should come from within the family. And no religion, in fact, is against it. So most religions encourage. So here is where this is the final sort of slide on this particular talk is that this is a message you have to pass on to everybody. You know now what is organ transplant, why is it important, how can it save lives, and there are a lot of centers that are capable of doing it. So here, what is the impediment is the lack of organs. So this is the message you have to pass on. Don't take your organs to heaven, but heaven knows that it is needed here. So it is to be donated to the needy people so that, this is another good quote that, it can be something, a sorrowful situation can be made into a, hopeful sort of life. Now, I'm sure I'll be able to answer your queries online for whatever you have doubts about organ transplants. I'm sure you will have a lot. But one thing I would just want to emphasize is that, see, there is a lot of scope for research, lot of scope for work in organ transplant yet. As I told you, one of the greatest impediment in organ transplant is the rejection. And the drugs that are used for rejection, stopping rejection are called immunosuppressants. There is a lot of research. One of the most thrust areas of research in the whole medical science is on this, preventing the rejection, either by making the organ friendly to the person who is receiving it, or by devising drugs which are less harmful to the patient when you take it. So these are some areas where, when you look at it, research is going, and then in future, anybody of you taking up medical profession can be involved in that sort of research. So let me take you through few 3-4 slides. Why medical profession, and why is it, what is the virtue of being a doctor, and then what is special about being about medical profession. This is important because many of you would have thought about, either in a sort of dilemma of choosing this way and that way. I just want to end with few slides. See, this is something which you have to take into your heart. Medical profession deals with alleviating human suffering. There is no other profession which does that. Every profession is to alleviate human suffering, but medical profession is the one which does maximum. And this is one of the professions which is essential for humanity. There are a lot of things. See, even though it might be crude to say that arts and music and all, is so enjoyable. We cannot live with that, but it's not essential to humanity. Whereas medical profession, medicine is essential. And it is something which gives you satisfaction. When I treat somebody, the amount of gratitude you get from the person who receives it, they may pay me back with money, but the satisfaction I derive out of the gratitude they have because of the treatment you have given, because of your health, is much more valuable than the monetary benefits you get out of this. And more importantly, the challenges, the problems, the sorrows, and all those things you meet with the patients every day, day in and out, make you much more humane. You know the incapabilities of human body, you know the incapabilities of a human being. There are a lot of limitations. We all think too much because of, especially with the involvement of artificial intelligence and other things, we all think supreme. But when you look at it, we are all fallible, and that comes to know when you are a medical profession. That is why choosing a medical profession then can make you more humane. I'll just take you through, see, marvels of medical profession. I just want to show you just this picture. This is a guy who had a huge tumor. His face says, his wife's face says it. And you can see the medical fraternity coming together in this endeavor of treating this guy. There are a lot of people involved. There was engineers, there were technicians, there were medical oncologists. So, but now you can see the patient back, enjoying life, back into life. So you can see he couldn't drink. Now he can drink with support. So these are the things which you can achieve by medical profession. By working together with different people in the medical profession, you can achieve these things. So what else to end? Is it, why should you think of choosing medical profession? It gives you varied options to pursue. Even if you are a doctor, you need not treat the patient every day. You say that I cannot face that. But there are a lot of other things. You can be a doctor. You can be a doctor scientist. You are of a person with a research bent. So will your research stop with being a doctor? No, you can be a doctor scientist. You can be a, you don't want to do anything. You want to do mostly in the lab. You can be a basic sciences researcher. Or there are a lot of allied health specialties coming up. So you can choose one of them. So you can be a nurse, you can be a physiotherapist, you can be a respiratory therapist, you can be a perfusionist, you can be optometrist, lot of things. And then you can go into PhD in any of these things. So sky is the limit. The options are numerous if you're choosing a medical profession. So let me end here. Thank you all very much for giving me another chance to talk to you all on this. So I will end here.
Thank you very much, Dr. Iyer, for this informative session. The question link is active and the students can shortlist their queries in the link. The date of the Q&A session will be intimated shortly by email looking into the availability of Dr. Iyer. Once again, thanking Dr. Iyer from the bottom of our heart.
Thank you very much.